Hi there, my name is Mia Sarosi. I am a licensed massage therapist, and today I would like to talk to you about massage therapy and why it's good for you. We're going to talk about the history of massage, what happens when our body stresses, and what massage therapy can do to remedy this state of stress, and what massage therapy cannot do. So I'm going to start with the brief history of massage therapy. It is known as the oldest form of non-invasive manual therapy, rooted in Ayurvedic tradition from thousands of years ago. It is based on observations of the benefits of touch by caring practitioners. Ayurveda, which means life health, is considered a non-scientific method. It is not generally referred to as an accurate source because it is not backed up by scientific data and observation. But it is valued as a spiritual and physical aid to whole body wellness. The human touch has been valued as a soothing, calming, and helpful form of healing technique in most cultures around the world. Think about loving touch from a caregiver or a relative when we're distraught or anxious has a soothing, reassuring effect. A hug, a firm handshake, a blanket, anything that provides a gentle, firm, loving pressure will feel good and reassuring. So jump to medicine. In the 1700s, surgeons employed mostly women to aid with recovery post-surgery, manually manipulating tissue to encourage healing and rehabilitation in the surgical areas, in the tissues and the joints. These people were respected and valued in the medical community. In the 1850s, Per Henrik-Ling of Sweden developed techniques to promote health, prevent disease, and treat illness and injuries. The title of masseuse and masseur became common in the 1880s, referring to manual therapists trained in soft tissue manipulation developed by a European medical doctor named Johann Metzger. That practice was mostly based on a gymnastic type manipulation. It included passive range of motion and the development techniques of friction that Metzger produced and based his studies on. So the Swedish movement approach was scientific and holistic, two principles that remain deeply ingrained in the field today. Perling insisted that movement and manipulation prescriptions be based on anatomy and physiology and be proven by clinical trial and measurement. He also believed in the unity of the person, body, mind, and spirit, and that movement profoundly affects the whole person in maintaining or restoring health. The medical gymnasts, which they were called at the time, laid the groundwork for a unique profession of highly skilled, hands-on specialists outside of conventional medicine. The current modern practice of licensed professional massage therapy in the United States took root in the early 1900s by European trained practitioners who came to the United States and has steadily gained importance as a complementary manual therapy to Western medicine. The American Massage Therapy Association is the first and oldest professional organization for licensed massage therapists in the United States. It has been established since 1943. It regulates the schools that teach massage, and it sets standards of practice and ethics for professional massage therapists. So today's masseur and masseuses, whom we now call massage therapists, for hands-on or specialists, are still educated in the traditions of Ling and Metzger. Massage therapy is acknowledged by the National Institute of Health, the medical community, and many health insurance companies provide benefits as a non-pharmacological method for pain management. So if you want to find out if your insurance covers massage therapy, please feel free to call any of our clinics, and the ones with massage will check to see if your insurance benefits cover massage. So what happens when the body is under sustained stress? Stress and anxiety trigger the fight or flight or ready for action response from our nervous system. When the sympathetic nervous system is engaged, this is the part of our central nervous system responsible for the fight or flight. The body directs most of its resources to the brain and skeletal muscles to respond to challenges from the environment, in emergencies, when we exercise, or when we're excited. This response is regulated by the hormone cortisol, often referred to as the stress hormone, because it is released in the brain to increase nutrient levels in the blood, such as glucose, fatty acids, and amino acids. These are substances that supply the body with energy. Normally, cortisol levels are highest just before waking in the morning to ready the body for activity. If triggered by stress during the day, this mechanism is interrupted, resulting in excess energy use and strain on the body. Well, in everyday life, hurrying to and from work, taking care of your family, worrying about finances, the environment, your grades if you're a student, or just in general being in a state of frenzy and rush, the sympathetic nervous system is constantly engaged because a steady supply of energy is needed. The driving force of the response of that sympathetic nervous system is the hormone cortisol, and that initiates quick and powerful muscle contractions or a constant ready-to-run state. So the heart pumps faster, increasing blood pressure, the lungs exchange gases faster, the blood vessels constrict to deliver nutrition and oxygen to the skeletal muscles quickly. Imagine a car's engine running at a high RPM instead of at a steady idle. So the major downside of being in this state of high alert for long periods is that the body uses its stored resources and they are not being replenished. Digestion to supply nutrients, regenerating and repairing damage to tissues, elimination of waste from the digestive tract is put on hold, and control of normal breathing and heart rate is muted. This means that the body is burning fuel, but the tank is not being refilled. So as one can imagine, this is a very bad state of being. The body refers a very narrow range of deviation from its equilibrium, which we call homeostasis. This is the bottom of the pendulum's arc. Swinging too far away from this middle can be taxing on the whole body, especially on our heart, the digestive system, and even our DNA. Researchers at Harvard Medical School in a study have found that DNA damage due to stress is evident. The DNA is the template from which the body reproduces new cells, and when this template is damaged, the new cells produced will not be as good as the old ones, so the body shows aging. Okay, so here is when massage therapy may be helpful to you. So what can massage therapy do for you? It has been shown in clinical studies that massage reduces stress and anxiety, helps to restore balance in the nervous system, to engage the parasympathetic response, which is when the body is at rest. In this state, cortisol production is reduced or completely stopped, slows down the activity in the using phase and re-engaging the replenishing phase, which is when the body restores and rehabilitates damaged tissues. So the hormones opposing the stress response are called endorphins. These are hormones that induce a sense of euphoria, such as serotonin and oxytocin, a hormone that increases the feeling of calm and improves mood and physical well-being. The comforting touch of another person, even petting a dog or holding someone's hands, has been shown to induce production of oxytocin. So one of the most immediate responses from massage therapy is the relief of tension in the skeletal muscles from injury, overuse, and stress. When we reduce the tension in the skeletal muscles, this in turn reduces the compression on the joints. It also induces a sense of relaxation because you go from feeling like a tightly wound rubber band to a soft, limp noodle. This is a term my patients use all the time. Massage therapy can also aid in the reduction of inflammation by reducing the tension and the production of the stress hormone cortisol and epinephrine. So it reduces the production of these hormones. And this keeps the body in that parasympathetic state. Disengaging the skeletal muscles by creating the awareness of the tension. Most people are not even aware that their shoulders are tight. All they know is that their shoulders are hurting. So just placing hand on the tissue that the patient complains about as being tight often makes them aware that it is engaged. And they will often say, oh, I didn't realize my shoulder was so tight. And then I say, well, there is the problem. So re-engaging that awareness of the tightness in the tissue and then facilitating the tissue of releasing and letting go will produce that sense of relaxation. So let's see, what else do we have here? Inducing the feelings of relaxation from the release of oxytocin and serotonin. We talked about that. And it also reduces the general anxiety. Anxiety is unfortunately produced by this heightened state of fight or flight. So switching the body out of that fight or flight will often reduce anxiety. It can ease back pain and leg pain in pregnancy, because when a woman is pregnant, her body actually produces extra blood and fluids. So some of this fluid can sometimes pool in the extremities, and a gentle massage and passive range of motion can help with reducing the swelling. Okay. Increasing the circulation of the fluid exchange in the soft tissue, again, by relaxing the skeletal muscles. It can support a healthy sleep cycle due to relaxation and stress reduction. So again, we talked about the effects of cortisol when the body's in this extended state of high alert. And when we're in that state, sleep is not going to happen. So reducing this state will help with the sleep. It can aid healing post-surgery by mobilizing the layers of soft tissue and scar tissue. So the body's tissues are, well, the ones closest to us are the skin, underneath it is the fascia, and then the muscles. And just the friction of massage can help separate these tissues and increase the circulation and increase the range of motion. Aid in pain management and reduction due to disease, overuse of muscles, stress, and medical procedures. Unfortunately, I think most of us are aware of the opioid crisis in not just our country, but in the world. And alternative forms of pain management have been sought. And one of these things is massage therapy. And the other thing that can be helpful is the CBD use. I offer massages with CBD oil at our clinic. And so if that's something that you're interested in, then please ask for it. CBD is a chemical found in marijuana. It does not contain tetrahydrocannabinol. I'm going to say this one more time. CBD is a chemical found in marijuana. It does not contain tetrahydrocannabinol. This is the psychoactive ingredient found in marijuana that produces a high. CBD does not contain this. CBD only induces a sense of calm and relaxation. So massage therapy is a complementary treatment to medicine and physical therapy. It is also widely used and promoted to help reduce anxiety and induce relaxation in the mind and the body. Again, maintaining and supporting and re-engaging that mind-body connection. Awareness of the pain in specific areas of the body. It helps to reconnect different parts of our bodies and then create our awareness of what causes the pain and how not to. So pain is also the body's primary communicator. When we're in pain, it just means that something is wrong. It doesn't mean that we should just keep going. It means we need to stop and address it, and massage therapy can help with that. So what massage cannot do? It cannot heal damaged tissue or muscles. That's obvious. We are non-invasive. We only work on the outside of the body. We cannot eliminate the disease. which is caused by a pathogen or deterioration of the body tissues, and cannot permanently relieve pain and or damage to the body. Massage is a complementary treatment, and it is recommended to be used instead of opioids or other pain medications. It doesn't always work, but when it does, it is definitely a nice alternative to these other forms of pharmaceuticals. And thank you for listening. Here's my contact info. If you're interested, you can call and make an appointment at our clinic in Silver Lake in Everett, Washington. And it's been wonderful talking to you. Thank you.